Hi, I'm Dr. Pichini, and I'm a chiropractor in the Rexdale Etobicoke area. And on behalf of Revitamax Rehab, we wanted to thank Soka Size for inviting us to the Flaunt Challenge for the next 30 days. So I know many of you are stuck at home, social distancing in light of this whole COVID-19 situation, and many of you may have had back pain throughout this pandemic, or maybe you've had back pain for a number of years and you're looking for a possible solution or a possible reason as to why you might be having that back pain. Well, in this little blog that we're going to be doing today, we're going to be discussing 5 possible reasons or 5 red flags that could be causing your back pain, or possibly 5 things that could be a possible cause of back pain for you in the future. So today's our topic on 5 reasons you might have low back pain. So the first possible reason could actually be coming from weak core muscles. So typically when we think of the core, we always think of the abdominals, but that's a misconception because there's actually more than just the abdominals that make up your core. So the core is yes, you do have the abdominals, but there's also these deep muscles such as your transverse abdominis, your internal obliques, your external obliques, all these deep muscles that are attaching around your core, even throughout the back, that are holding your spine into a very stable position. So have you ever noticed that when you stand for a long time, some people tend to, they can't stand in one spot. They tend to kind of shift from side to side, almost as if like they're doing a little bit of dance in the spot. And usually when people are trying to stand, the reason why they're dancing from side to side usually has to do with some stiffness or some pain that they're getting in their low back, and moving from side to side on the spot tends to relieve some of that pain that they're getting. So take a look at yourself and see if you actually do that in your daily life when you're standing. And a possible reason why you're doing that could be because you have a weak core. So some possible things that you can do to help alleviate or to help to fix your core is to build endurance in your core. I'm going to outline some exercises that you can do at home to help build more core stability, as well as help to build more endurance in your core. The first exercise that you can do here is called the bird dog. So what you're going to do is you're going to go into this on all fours position, and you're going to extend your opposite leg and opposite arm right off the floor, just like this lady's doing here. And you're going to try to keep your core stable while you're doing this. Here is called the side plank. So what you can do is, just like this gentleman is doing in this video, you're going to lie down on your side, and you're going to use your knees to bring the side of your body here off of the floor. And you're going to hold it there in that position for about 5 seconds after every rep. Your third exercise that we're going to look at to help build that core stability and endurance is the curl up. So in this position, you're actually going to lie down on your back with one leg bent just like so. Your hands are going to be behind your back, sitting on your hands, and you're going to try to bring your shoulders off the floor, just like this gentleman's doing here. So these 3 exercises have actually been heavily researched by a researcher named Dr. Stuart McGill, and they're called McGill's Big 3, and they've been clinically proven to help build core stability and build endurance. So if you're suffering from some of that core instability or core weakness, just like how we pointed out, a possible sign could be you moving from side to side, can't stay still in one spot because of that back pain, some of these exercises that we just demonstrated might be useful for you. The next possible reason you might have back pain or might develop low back pain in the future actually has to do with your butt, or the gluteus maximus. So the gluteus maximus, or your butt muscles, have a big part to do with how your spine functions. When you have a gluteus maximus, or you have butt muscles that are working properly, it actually takes a significant load off of your spine and helps your spine work functionally as it should. When you have an underdeveloped glute max, so if your glute max is weak, it actually forces your low back and your spine to work even harder in order to bend, lift, twist, and do certain functions that we usually do on an everyday basis. So an underdeveloped glute, it is a possible reason as to why you might be having that low back pain, or a possible reason you may develop that low back pain in the future. So how do you know if your glutes are weak and you need to strengthen them in order to help save your back? Well, there's a couple of tests that we can do. One is simply just look at yourself in the mirror. Look to see if you have a well-developed butt muscle. How do we know if we actually have a weak glute? Well, there's some tests that we can do. One test in particular is actually going to be demonstrated in this video that I'm going to show here. So ideally what I want each of you to try when you get home is to try this. You're going to lie flat on your stomach and you're going to have your heels touching each other and squeezing together. And then without lifting your pelvis off the floor, you're just going to lift your legs up and you're going to try to hold it in this position for a little while and see how well you can actually do that. Some of you actually might be having some trouble even just lifting your legs off the ground. That's a possible sign that you have a weak glute and could be contributing to your back pain. Other people might have a problem in sustaining this position for a little while, and usually if you can't sustain that hold up position, that could be a sign that you have weak glutes. Our next topic we're going to talk about as a possible red flag for low back pain has to do with your hip flexors. So one muscle that actually plays a really big role in flexing your hip is the psoas. Now the psoas, as you can see, actually starts and it attaches to your spine and it makes its way down the pelvis and inserts right here onto your hip. Okay? Now, some people who have low back pain and they feel that tightness in their hip, if you feel like you have tightness in your hips and you have low back pain and you try to stretch that out and you find that that actually helps to relieve some of your pain that you have in your low back, a possible reason could be you have tight hip flexors. So how do we know if we have tight hip flexors? In this next video, I'm going to show you how you can test to see if you have tight hip flexors and possible things that you can do to help to alleviate those tight hip flexors. So a common test that we actually use here in the clinic to determine if you have tight hip flexors is a test called the Thomas test. But the Thomas test doesn't necessarily have to have a chiropractor or physiotherapy in the room. You can actually test your hip flexors on your own. And here's a simple way that you can do that. So if you were to lie down on your back onto a table just like so, have one leg dangling off the table and the other leg is bent and held with your arm and you pull, you're looking to see if your leg can stay flat on the table or if it actually will lift up just like it is in this situation here. If it stays flat on the table, it usually means that your hip flexors are loose enough. But if you find that it tends to lift up off the table, as this leg is coming up, so the opposite leg that you're holding lifts up off the table, it's usually a sign that your hip flexors are tight. And that could be a possible reason why you're having your low back pain. Another possible indicator of low back pain or potential for low back pain might have to do with the way that you're sitting. So how many of us, when we're sitting, we start off our day sitting in our chair at work like this, and then eventually evolves into maybe one of these two. Well, if we can't hold that position in a normal neutral spine position while we're sitting, it's usually an indicator that our core and that our back isn't strong enough to hold us in that position. And that could be a weak back could be a cause of our low back pain, just like we were discussing, similar to the weak core. So what sort of things can we do at work to help make sure that we aren't sitting in these positions? One is you want to be aware of it. So nobody can hold this position all day. Ideally, you can only sit in a position like this for about 20 to 30 minutes. After about 20 to 30 minutes, one thing that you can do is actually stand up, stretch yourself up, and then again sit back into that neutral spine position, just like this gentleman is doing here. Remember that when we're sitting in a chair, an important thing that we want to keep in mind is that our lower back should be arched. So we should have a little bit of space in between the back of the chair here and our spine. We should be sitting so that our legs here, our hips are at 90 degrees and our knees are at 90 degrees. And that we should be sitting so that our ears are in line with our shoulders are in line with our hips, And in doing this, it will actually put the least amount of stress on your spine, which will help spare your spine in the long run. Our fifth and final reason as to why we might be getting low back pain might have to do with underneath our feet and how our feet are aligned. So usually there are people who have a normal arch, there are people who have a flat arch, and then there are those who have a very accentuated arch. And I actually don't have the image here, but just imagine this arch being a lot higher than the other two here. Now, typically, if you have a normal arch, you should be able to stick 2 fingers and fit them underneath the bottom of your foot, which means that you should have enough space between that top of that arch and the floor to stick 2 fingers. So you can actually do that test yourself. You can be standing and try to put 2 fingers or have someone put 2 fingers underneath your foot and see if they can fit them there. In the event that we can't do that and there is no space between the top of our arch and the floor, a possible reason is you have a flat foot. Now, a flat foot has been associated with low back pain, and there is a reason why. So if you take a look at this image over here, you can see that on one side you have a normal arch, and you can see proper alignment of the joints that are just above. So proper alignment of the ankle joint, the knee joint, the hip joint, and the low back as a result of having that proper normal arch. So the normal arch it helps to maintain proper posture, proper alignment of those joints. If we have a flat foot, what ends up happening is that whole chain, kinetic chain as we call that, comes out of whack. So you can see that a flat foot could contribute to a difference in angle of your ankle joint, which can throw off the way your knee joints. You can see that angle here, which can throw off the way our hip joint sits and our low back. So as a result of having that flat foot, all of these joints that are going higher up above the foot could be out of alignment, which puts a lot of stress. It puts a lot of stress on those joints, especially your low back. And that could be a reason why you're having low back pain, or a possible reason that why you may develop low back pain in the future. Now the question is, what can we do about this? Well, one possible solution could actually do with a custom foot orthotic, which we actually provide and fit our patients for at the clinic. A custom foot orthotic is this shoe insert. So if you look here, you can see that there is this custom foot orthotic underneath this gentleman's foot. And it's a shoe insert that's custom made for your foot to help gain proper alignment and proper posture of the foot, as well as the joints that are going above. So from a flat arch that might be putting all of these joints out of alignment, a custom foot orthotic can help put all of those joints in realignment, put them in proper alignment, just by having that proper support underneath your foot. So a custom foot orthotic could be a possible solution to help you with your low back pain as a result of a flat foot. So do you have low back pain, or do you have any other types of pain that are a result of muscles, joints, or nerves? At Revitamax Rehab, we actually are experts in helping to find out what's causing your pain, as well as give you the treatment that you need to help recover from that pain or help prevent that pain from happening in the future. So what we'll do, a typical visit to our clinic would be allow us to assess you, to find out what's going on with your situation, what's causing your back pain, what's causing your knee pain, your hip pain, your back, your shoulder pain, and then from there we would come up with a treatment plan to help to resolve that issue for you, as well as tailored exercises to help prevent that pain from coming back or that issue from coming back. So at Revitamax Rehab, we do physiotherapy, chiropractic, massage therapy, acupuncture, custom foot orthotics, compression stockings, as well as custom braces. And as a special gift to everyone here at SoCasize, we're offering a free consultation that can either be done within our clinic or it can be done virtually, face-to-face over technology that we have called telehealth. So if you're interested in doing that, and doing this free consultation to find out what could be causing your pain and solutions that could help to resolve those issues, feel free to give us a call. Our number is 416-360-8326. Just let us know that you're from Ahsoka Size and that you're looking for the free consultation, and we'll be happy to book you in at a time that's convenient for you. We're open typically from Monday to Saturday. From Monday to Friday is 9 a.m. till 7:30. Saturday we're there from 9 till 4 o'clock. And we can find a time that works best for you to do this free consultation. So there's no obligation to pay. It's a great way to find out what's going on and a great way to find out what can be done and what sort of solutions are out there to help you with your pain. Thank you guys very much for inviting me out to the Flaunt Challenge. I'm really happy to be here, and I'm really happy that I was able to educate you guys on possible reasons why you might be having a little back pain. So please give us a call at 416-360-8326. And if you're looking for more information, you're always welcome to give us a call or reach us online at www.revitamax.ca. Thank you very much. Stay safe and be healthy.